Welcome to another edition of the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm the medical director at DAMY Health and here at the Finlandia Health Center. I'm a naturopathic doctor focused on the integrative care of chronic disease. We try to prevent chronic disease, we try to minimize the usage of medications in chronic disease, and we try to make the side effects of medications minimal as much as possible. Today on the show we're talking about fasting insulin. If you like topics on the integrative medicine spectrum, please subscribe for more like this one. If you're interested in fasting insulin, I love talking about it. I haven't done very many videos about it, but I think it's an incredibly important test that's not done very often by the conventional system. Usually the conventional system does fasting blood sugar, and that's really enough to say if you have diabetes or not. It's really enough to say where on the spectrum of metabolic syndrome you stand. But there's so much utility in fasting insulin. I think if you're worried about your blood sugar and the blood sugar comes back normal, it's really helpful to know fasting insulin. Fasting insulin's been associated with increased risk of hypertension or high blood pressure. It's been associated with an increased risk of coronary heart disease, so blockage in the heart, but it's not associated with an increased risk of stroke. There was a meta-analysis done in 2013 that showed these two things. So, I really like to know it. We know that's how you find out your HOMA-IR, which is an international score of insulin resistance. It's not the best way to measure insulin resistance, no doubt, so don't bother commenting on it. But it's the only way that we can assess it kind of using lab tests in the office. If you're, we're not going to do insulin clamps in the office, but what we can do, we can do a fasting insulin, we can plug it into a HOMA-IR calculator with your fasting blood sugar, and we can find out if you're on the spectrum of insulin resistance or not. It's so helpful to know. Like I said, high fasting insulin is associated with an increased risk of coronary artery disease, and it's also an increased risk of hypertension, which then can lead to problems with the heart. I really like to know fasting insulin. I find it helpful to know for blood sugar dips during the day. So for sort of reactive hypoglycemia, I find it helpful to know when we're trying to do weight loss. I'm trying to help people lose weight, especially if they have a diagnosis of some sort of autoimmune condition, or if they're on the metabolic syndrome spectrum. So if they already know they have a high fasting blood sugar, it's nice to know the fasting insulin. Like, is the pancreas working too hard, or is it not doing a good enough job? Should we double down on improving insulin sensitivity, like with weights and challenging the whole body? And then should we do all the supplementation? Should we do berberine and chromium and high fiber foods? Or do we need to be do we need to go full on keto? Like, do we need to cut carbs out completely and really drop the insulin down? What do we need to do? Are we going to be doing a continuous glucose monitor with this person? So they're going to be forking out the cash to check their blood sugar all the time? Or is it not that complicated? Can we do maybe a keto diet with a daily breath test? Or what can we do here? Fasting insulin can help guide our judgment. It's a very inexpensive test to do, and I find there's so much utility in it, especially if you're doing optimal wellness. Like, you've had your blood sugar checked, you've had your cholesterol checked, everything's normal. Well, let's get a fasting insulin test to see how you're actually doing, especially if you feel like there's a couple pounds you need to lose, especially if you feel like your body fat percentage is a little bit too high for where you'd like to see it. You can tell that just by, if you have a little belly, or if you feel like you have, maybe 10 pounds to lose, get your fasting insulin checked. It's so nice to know. I'm hyper focused on preventing coronary heart disease, and it seems like fasting insulin is a good one to do. We do homocysteine testing, we do obviously LDL, we do ApoB100, we do LDL particle number, we're doing omega checks, we're doing a bunch of different things, LPPLA2, LP(a). We're doing all these cardiovascular assessments, and sometimes it's just really nice to know fasting insulin. That's what I wanted to comment on today. If you haven't had it checked and you're looking to do longevity, profile, or your protocol, or you're just really trying to keep your heart healthy long term, knowing your fasting insulin, I think, provides a ton of value. That's all I wanted to comment on today. This show is all about what's going on in my clinical practice, where I think people can find some extra benefit with integrative or complementary medicine, where they can use alternative approaches to improve their overall wellness, to apply the holistic approach to their condition they're trying to work on, or if they're really just trying to prevent disease in general. That's pretty much what we do here all day long. I like to do fasting insulin with people because it's kind of that piece that hasn't been done, especially if someone's really into alternative wellness or if they've had a big cardiovascular profile done. Even then, sometimes fasting insulin isn't checked. So it's a nice one to do. What else is to know? Okay, so this show, we're just basically going to be tracking what I'm interested in, what I'm doing in my clinical practice, and where I can find some benefit for people. One thing I was looking at today was using GABA supplementation. In Canada here, we can do GABA supplementation. Not a lot of it crosses the blood-brain barrier, but some of it does, and it seems to be helpful for calming anxiety. Well, what I was looking at today was how GABA can actually inhibit gallbladder cancer cells in a petri dish. GABA has some mechanism where I need to look further into it, where it can downregulate the metastatic potential of gallbladder cancer. Very, very cool study. Gonna read through it tonight. Just came across it today, and I'm obsessed. So I'm always looking to see where supplements we have access to can be applied to the patient base that I see. If you found anything unique about alternative, integrative, or complementary medicine that you'd like to share with me, please let me know in the comments below. I'm open to hearing anything or reading any study or commenting on anything that I see. Thanks so much for tuning in. If you like shows like this one, please subscribe and hit that bell so you can get notified of for when I post. Thanks for watching. Have a great day.